Hey guys, it's Bear. It's Friday, July 24th, and this week marked 6 weeks since my top surgery. So this is my 6-week update. I'm also going to do a little bit of a management tutorial because I see a lot of questions online about, you know, managing your recovery, managing the incisions and so forth. So I'll get to that towards the end of the video. 6 weeks post-op is when they tell you that you're unrestricted and you can go back to work. They told me I could go back to work at 5 weeks, but with a lot of restrictions, and I chose to wait one more week. I used week 5 to ramp up my activity level and to try to get my sleep schedule a little bit more evened out. I work at a coffee shop, so I get up really early in the morning, so I've been trying to get my sleep schedule adjusted, because somewhere in the recovery I just got this major insomnia and I was not able to go to sleep until like 3 or 4 o'clock in the morning for a couple of weeks. So that's a little harsh. I'm getting up at 4:30 right now and just trying to force my body to get used to that. I've also put my own restrictions on myself. They say you're unrestricted at 6 weeks, but at week 5 you're still not allowed to lift more than 10 pounds. So obviously there's got to be kind of a ramp up there. So I've just been careful about lifting too much and stretching and reaching. Now my range of motion is pretty good. I can reach up above my head. I can reach back behind me, you know, both sides. And it's a little bit tight, but it's not painful. And it doesn't, you know, it doesn't feel like it's stretching. Obviously you have to be careful about your scars stretching. So I have been careful about, you know, leaning and reaching and stuff like that. And I'll ramp that activity up just based on how I feel. They also told me to slowly ramp up my martial arts activity starting at week 6 and to rejoin classes at week 8. Honestly, I didn't listen to that, and I went back on Monday and I did some jiu-jitsu. Did a really pretty light roll with a friend who knew that I was pretty restricted. Felt really good about it, and then took my shirt off and I had a lot of bruising at the base of the nipples and a little bit of blistering. In fact, you can see a little bit of the blister left here. And that's just, I'm not sure why the area bruised and blistered versus why other people's nipples don't. But I can tell you that what I didn't realize going into it was that I can't feel the light touch in this on my nipples. I can only feel pressure. You know, the rest of the area I can feel light touch again. The nipples not so much. And so what happened is I was hurting myself without knowing I was hurting myself. And that was dumb. I should have listened, and I will be more careful moving forward. You know, I didn't do any real terrible permanent damage. You know, bruises heal, chafing heals, blisters heal, and I've been following up with aftercare. In the future, you know, I'll be more careful about covering the area as far as protecting it against abrasions with like a bandage, so that any sliding isn't causing chafing. Ultimately, it was my decision. It was a bad decision. I learned from it, and I'll be more careful moving forward. You know, one of those things where, honestly, I can be a very patient person, and I can also be a very impatient person. And towards the end of my recovery, I just got really frustrated with how much I was sitting around. I was going and watching classes, and that got really frustrating as well. So, my mistake. You know, I'm a firm believer in owning your mistakes and learning from them. So that's what I've done. Other than that, like I said, you know, going back to work kind of slowly, ramping things up, you know, and next week I'll have pretty much a full schedule, and I'll be starting to do more massage. You know, that's my second job. So and I've done a little bit, and I felt good, so I'm not really worried about it. So aftercare, as your nipples, if you had a nipple graft, they're gonna scab over because that tissue is removed from your body and put on ice for however long that they're doing the rest of the procedure, and because of being removed from its blood source, the tissue, especially the outer layer of tissue, dies, and that's why it's going to scab over, and as the scabs peel off, it looks kind of scary. You can look at my last 2 videos and see that it doesn't look fun, but it's normal. So as you're healing from that, you know, they want you to treat the nipples, they want you to treat the incisions. So I'm going to show you, you know, just basic treatment. Now my nipples are technically healed, aside from the little bit of blistering that I caused, and so the nurse told me, you know, to go ahead and stop treating them with anything except for maybe some Aquaphor just to keep them moist, but she even said not to worry too much about that. I've been using Bacitracin, you know, from Walgreens, using a fair amount without too much, because you don't want to have too much moisture, but you also don't want them to be dry. And you can see I'm putting a fair amount of pressure as I just sort of massage the area. They want you to massage the entire area, and I'm going to get to that in a minute, but especially, you know, or even the nipples, or rather the areolas. So getting the Bacitracin all around. The other reason I'm still following up on it is that the right one here still has a little bit of a scab left, and they both have some sutures still hanging out, and there's a mild chance of infection while those finish dissolving. So I'm going to continue to treat it with something that has an antibiotic in it, like Bacitracin or Neosporin. And you can see, you know, again, putting a fair amount of pressure on it, because you want to massage it. You want to get the blood flow in there. So that's the nipples. For the incisions, I'm using a bio oil knockoff that I got from Walgreens. It was like $4 or $5 cheaper. I had a hard time finding this, actually. I had to finally look online for a Walgreens that had it in stock, even though it's a fairly common product. I might switch from this to a homemade product that a friend, an herbalist friend, is working on for me. She's really busy though. She's got like a 18-month-old, so it's just a matter of kind of linking up with her. And this stuff's pretty good. A lot of people swear by it. I did a lot of asking people online, and I asked a couple of friends who had had procedures where they had major scarring, and not 100%, but most of the time they came back to saying the bio oil. What I like about it is it's not real, it's an oil, but it's not real greasy, and it doesn't get in my clothes, so that's cool. But, you know, you're going to take, you know, enough to get the area moist, and then massage it into your incision area. This is one of the questions I've seen a lot online, and this is why I wanted to do this video, is people asking about what that means to massage the area. You can see that, you know, I'm putting a fair amount of firm pressure, and I'm just using, you know, the last 2 digits of the finger to just go in a gentle circular motion. You can see that it's moving the skin around somewhat, but without doing a whole bunch of stretching. You know, you just want to get enough on your incisions to get the area moist, and you basically want to rub it in until it feels like when you put lotion on, basically, where it's not moist anymore, but it's not necessarily dry either. And so, like I said, you know, using a fair amount of pressure, just in a circular motion. This is specific for the incisions, and I also do the same all around the area where there was any tenderness and numbness, any liposuction, you know, up into the border of the pec and everything, with a focus on any area where there's nodules. You can maybe see that the skin is a little bit raised right here at this corner, and I do still have that dog ear in the right side, even though it's definitely gone down a lot, and I think we're not going to end up doing a revision, which is really cool. I'd like to avoid doing any revisions. But basically what you're doing is you're breaking up any scar tissue underneath. You don't want scar tissue underneath because it's going to cause the the final result to be uneven or to end up with, you know, a lump there, or the scars could ripple. And also, you know, like I had mentioned before, massage is good for you because it brings blood flow into the area. So especially where you're healing like this, you want to do it. And, you know, in the case of any kind of injuries and stuff like that, that's what massage is for. That's why it's recommended. I will do the other side, but I just wanted to show you the last bit that I've been doing is that I've been taking a 2x2 piece of gauze and a little bit of surgical tape just to keep the nipples covered. And I'm doing that for two reasons, even though they said I could stop doing it. First of all, it's just more comfortable. Second of all, since I'm still treating the area with the Bacitracin, which is greasy and stains your clothes, I don't want every single rash guard and t-shirt that I wear to have, you know, greasy nipple marks. That's awkward. And, you know, your clothing is going to move. And so to avoid any more chafing, I'm just gonna go ahead and keep them covered. So, and you can see that I've got a little bit of a mark right here. Yeah, there it is. That's from the tape. So that's just from irritating my skin a little bit. It's not, you know, a problem or whatever. It's just like a Band-Aid. So yeah, I just get that and gently cover the area again so that the clothing isn't rubbing on it and my clothing's not getting stained with Bacitracin. So that's aftercare for your double incision procedure for anybody that's been told to massage the area and to treat the area. That's what I've been doing, you know. And yeah, that's it. That's my 6-week update. Hope that it was informative. If you've got any questions, go ahead and comment on the video or message me, and I'll follow up with them either, you know, by messaging you back or doing a follow-up video if I missed anything. Thanks for watching, guys, and I'll see you next time.